cardiology hat on, I think you will understand what I'm saying here is that my pediatric cardiologists who trained me were very sort of they were purists. वो कहते थे कि देखो अगर इंटरवेंशन करनी है तो इंटरवेंशन करनी है, अडल्ट कंजल करनी है तो अडल्ट कंजल करनी है, तुम अगर जहाँ पे मिक्स करोगे तो you will struggle a little bit because you won't be really good at one thing versus the other. So the point I'm making with that question is that you can't bring in intervention within 2 years of ACHD training at this point. So if you want to do intervention, then you might have to add to what you're doing. But that's sort of where it is right now. What is the training timeline of surgeons who do adult congenital heart surgery in US? So ये आपके लिए सवाल है.
Well, I could take that question,
yeah,
but most people who are doing adult congenital heart surgery have done their cardiothoracic surgery, which is 6 years. Then they do 2 years of congenital heart training, in which adult congenital is a part of that. So the people who are doing adult congenital, mostly all of them are cardiac surgeons who are primarily pediatric or congenital cardiac surgeons who then add this on, same way as you guys went through that. I had one question that, your 2-year fellowship training, it's accredited, it's board, but the candidate has to be a US board certified. What about non-accredited fellowship?
Sure, good, fantastic question. So the way it's working is to sit for the US board certification exam. At this point in time, they're going through US graduates, or North American graduates. There is a discussion where they're now bringing it, because there is such a dearth of ACHD physicians all across the country, not just in the US, across the world, quite honestly. They're now talking about bringing in international graduates to go through the 2-year track and then get them accredited if they can. This obviously, as you know, it's multi-year process to get that sort of approval. I will tell you 2 things. One is that outside the United States, there are some centers in the United States, but I can tell you in Canada, they do bring in external graduates, international graduates to Toronto General's adult congenital program, and they will put them through 1 or 2 years with the understanding that they will go back to their country of origin. So they will go there, train, Toronto will train them, and then they will send it back. So I don't want to speak to anybody who's listening to me in Toronto, I think that's what's happening in Toronto. So to your point, that hopefully will become something in the US. Abhi nahi hai, hopefully. Ji sir.
Ji, Assalamu alaikum. Thank you very much, Ali. On behalf of parents community, CHD, I would really thank you for coming to Pakistan and of course coming to Lahore. Just one quick question. What timeline you think parents should keep in consideration that now they should start taking their child to the adult cardiologist, not the pediatric cardiologist?
So that's a good question. So I'll tell you, sir, aap baat kar rahe the. It's a tricky question because unless you're trained in adult congenital heart disease, my recommendation, and I'm speaking as an adult cardiologist, by the way, I'm going to take my pediatric hat off completely. I'm speaking as an adult cardiologist. My advice would be, unless you are trained in adult congenital heart disease or you have significant experience in adult congenital heart disease and your background is in adult cardiology, then you can probably take care of patients coming through. But till then, you're probably better taken care of by pediatric cardiologists, even if you are an adult patient with congenital heart disease. Now, I'm talking about in Pakistan and in developing countries because I think it'll be very difficult to suddenly go over to the adult side. Now, keeping in mind that now I'm going to wear sort of my internal medicine hat on, is that these patients develop adult comorbidities. और यहाँ पे हम कभी-कभार mistake करते हैं कि हम लोग उसको सिर्फ congenital heart disease के paradigm में रखते हैं. मगर अगर आप as a physician उस patient को देखें ना तो उनकी diabetes भी होगी, उनकी coronary disease भी होगी, उनकी stroke risk भी होगी, उनकी kidney disease की risk भी होगी. So you have to bring in the medicine aspect of it. और वो part जो है वो हम as pediatric cardiologist पे उतना ध्यान नहीं देते. तो वो आपको थोड़ा balance करना पड़ जाता है. But my advice would be that in developing countries, unless you're ACHD trained or you have significant experience in congenital heart disease, you probably still should be followed by pediatric cardiologists and you bring in the internal medicine experience as and when you need to. Unless you have somebody, जैसे आप कह रहे थे कि who's trained and then you can move patients over.
Sir, we have another question from
What advice would you give to parents of CHD children going into teenage adulthood about care. So I think that's exactly what I just said, is that, so this concept of teenage adulthood congenital heart disease. So ये वो transition का period है जो I sort of jumped through. Transition is difficult. I mean, in developing countries, it's a big deal. But again, to Sir Jo, I think my thought is that in developing countries, is that you probably need to stay with pediatric cardiology until you have somebody you can transition the patient over to. So मैं आपको एक थोड़ा सा example देता हूँ ये सवाल का कि even in the North America, I'm going to wear my pediatric cardiology hat on. Let's say I'm taking care of an 18-year-old with, let's say, coarctation or single ventricle. I've taken care of that kid since birth, and now the kid is 18. And now in the US, if you believe it, the American Board of Pediatrics talks about transition of care for chronic health conditions starting at age 12 by American Board of Pediatrics. कि आप 12 पे आप बात करनी शुरू करें कि आपको 10 साल बाद adult medicine में जाना है. तो अमेरिका में भी ये बहुत मुश्किल काम है उन पेरेंट्स को समझाना कि जिस पीडियाट्रिक कार्डियोलॉजिस्ट ने आपके साथ 15 साल काम किया है उसको आप you have to leave that person and go to adult. So point I'm making is that this is a transition question, and until you have somebody on the receiving end who's trained, you probably need to stay with where you're at. But again, it's difficult because आप बहुत ज़्यादा उसको delay भी नहीं कर सकते. So you have to sort of find where your balance is going to be coming.
Dr. Ali, I can just add on to that.
जी.
Unfortunate thing happened in Pakistan is that when we started pediatric cardiology training, before that, the adult cardiologists used to rotate in pediatric cardiology for 6 months.
जी.
And they would have a decent exposure to pediatric and congenital heart disease. The moment we started fellowship in pediatric cardiology, they stopped sending those people to pediatric cardiology. And even if they would send it, they would send it for a much shorter period of time. And that's the unfortunate thing. So I think as far as our country is concerned, for the time being, I think as far as congenital heart disease is concerned, they would be better off sticking to pediatric cardiologists rather than adult cardiologists, but it has to be a joint care. I totally agree with you. We are not trained in diabetes mellitus management, coronary artery disease management, for that matter even adult hypertension management. I think that's something which adult cardiologist has to do. So it has to be a joint care till we have physicians in adult congenital.
Absolutely, and I think I reiterate, I don't want any resident fellow here leaving कि वो डॉक्टर ज़ैदी साहब आए थे उन्होंने कहा नहीं सब चले जाएं उधर. ऐसा नहीं कह रहा मैं, बिल्कुल नहीं कह रहा. मैं ये कह रहा हूँ ये बहुत ट्रिकी एक कॉन्सेप्ट है. इसको पाकिस्तान में, इंडिया में भी, quite honestly, I know a lot of people in India, आप लोग सब जानते होंगे, वहाँ पे भी ये प्रॉब्लम है कि you can't just sort of suddenly move them over to the adult world.
Thank you, Dr. Ali. That was very nice and very comprehensive, and I once again thank you on behalf of children.
Thank you so much.